everyone, my name is Farah and today me and my friend Islina will be talking about an article released in May 2019 which discussed on risk factors of low back pain among sport crane operator in Malaysia. So now you may ask us, why do we choose this article, right? To begin, this article generally talks about the effect of whole body vibration undergone by port crane operators in Malaysia. This issue is very important as this problem may lead to musculoskeletal disorders such as low back pain. By discussing on this topic, we can indirectly help port crane operators in improving their awareness on risk of low back pain. Ergonomics are used to reduce or eliminate work-related injuries such as musculoskeletal disorder or for short MSD. Today, MSD has become a major problem among workers. However, lack of attention has been given in improving MSD issue, especially low back pain among the operators. So, in this paper, the authors aim to investigate the risk factors of low back pain and identify the root cause of low back pain among sport crane operator in Malaysia. By achieving this objective, the authors are able to demonstrate the right method in order to assess the problem and find the root cause. Not only that, they can provide industries with information to improve low back pain as well as addressing the key risk factors in maintaining a safe work environment. So to achieve the objective of this paper, the authors have came up with steps of methodology. Generally, the methodology can be divided into 3 steps, which are data collection, data analysis, and triangulation of data. Firstly, related information was gathered prior to designing the questionnaire as it will be crucial to ensure reliable result to be produced. The questionnaire was then divided into 4 sections which include demography, MSD of each part of the body, assessment of low back pain, and lastly, working condition and environment. All input was gathered with the help of experts from DOSH, NIOSH, and occupational health doctor. Next, interview session was also conducted to give options for the respondents to express their problem in a different way. For this method, respondents with at least 5 years of experience in that specific job were selected as the effect of the working environment towards the workers is more significant above this period. RULA or Rapid Upper Limb Assessment was also conducted to the operators where their postures and muscle use were measured, and all those points were then calculated and summarized according to RULA weighting system. Lastly, vibration measurements of crane were also taken using a dose meter where it will be analyzed using Blaze software. This will then enable the author to look into detailed breakdown of the data and to initiate further tasks such as combination or comparison of data. Daily exposure value and value dose vibration were also included in this study. From the result, it has been highlighted that there are significant association between years of exposure to low back pain, where operators who have been exposed for more than 5 years were more likely to experience low back pain. This finding is consistent with a study done in Netherlands by Bongers et al. At port crane operators. Aside from duration of exposure, posture, which is long hours of sitting, and trunk bending were also found to be significantly associated with low back pain. These align with the study from Courtney and Evan, which concluded that static loading of the trunk and neck contributed to various aches and pains experienced by the drivers. Lastly, due to the nature of this job, prolonged sitting is a part of the routine as the operator needs to be at the workstation for 6 hours per shift. Other than that, slight trunk bending is required in order for the operators to clearly see the spreader at the bottom of the quiet crane. The combination of exposure of both whole body vibration and postural stress could increase the effect of low back pain.
Hi, Assalamualaikum warahmatullahi wabarakatuh. My name is Siti, Islina binti Basharudin. For this part of this journal, firstly, low back pain will affect our daily activity. It will trigger a domino effect. Because of the unbearable pain, the movement that we make will be difficult and slower. Also, in this journal, it is stated during the interview that one of the workers need to wearing a back support belt. It is to reduce the pain and cannot move like the normal person. Second, the pool estimate for the occurrence of work absence is 50.5%. The productivity of our workers will be decreased that lead to the absenteeism. In this journal, it stated that long-term exposure of vibration will increase the risk of lower back pain. Due to that, the company will have a problem with workers' attendance. Lower back pain is one of the most complained among people, but when it related to work environment, it is a serious case and immediate action are required. In this journal, the characteristic factors such as age, BMI, and sport are not significant to lower back pain. I totally agree with the result of this journal because the main causes that lead to lower back pain are work environment. Further study and fast treatment for lower back pain need to be conducted. According to other journal, the management of chronic lower back pain may take years with significant morbidity. In conclusion, managing lower back pain are really important to protect our workers from chronic health problems. Awareness about safety and health toward workers need to be mentioned frequently. Lastly, workplace design and workstation need to be adjusted and improved back. It can help to increase the productivity of the workers.